You wake up, and something feels different. There's a calmness in the air, a quiet joy beneath your ribs. You're 16 weeks pregnant, and although your baby is still hidden beneath layers of skin and womb, the bond you're building is growing stronger than ever. This week, magic is happening, both inside your body and within your heart. Stay with me till the end, because week 16 is where pregnancy begins to feel real, with new flutters, deeper emotional shifts, visible physical changes, and baby's biggest milestones yet. Let's dive in. At just over 4.5 inches and about 100 grams, your baby is now the size of a ripe pear or a small avocado. But don't be fooled by the size. Your little one is learning, growing, and fine-tuning skills that will one day make you smile, laugh, and cry. Here's what's changing this week. Facial muscles and expressions. Your baby can now make faces, squinting, grimacing, even little frowns. They're practicing facial movements in preparation for the outside world. Bones hardening. The soft cartilage that made up baby's skeleton? It's now turning into bone, especially in the legs, ears, and jaw. Their limbs are stronger and more defined. Eyes and ears. While the eyes are still shut, they can now sense light. Shine a flashlight on your belly and your baby might move. Ears are in place and developed enough to start hearing, and they're listening to your heartbeat, your digestion, and even your voice. Taste buds are forming. Yes, believe it or not, your baby can begin tasting amniotic fluid, and it changes flavor based on what you eat. Spicy, sweet, garlic, your baby's getting a sampler menu of your meals. Hair is sprouting. A soft layer of hair called lanugo is beginning to cover your baby's body. It helps protect their skin and regulate temperature. Heartbeat harmony. That little heart is pumping around 25 to 30 quarts of blood a day. If you haven't heard it yet, you might at your next appointment. It's usually around 150 to 160 beats per minute, twice as fast as yours. That little flutter in your lower belly? That could be your baby's first hello. What's happening in your body? Physical changes and symptoms at week 16. At 16 weeks, you're in the golden zone. That sweet spot where nausea fades, energy returns, and your body starts to bloom into its pregnant glory. But there are still new symptoms, some subtle and some surprising. 1. Noticeable baby bump. Your uterus is now halfway between your pubic bone and belly button. For many women, this is when strangers start noticing. Your waistline changes. Maternity clothes start feeling necessary. Your body is officially making space for life. 2. Round ligament pain, but more defined now. As your womb stretches, the ligaments anchoring it stretch too, leading to sharp, sometimes stabbing pain in your lower belly or hips when you move too quickly. It's more noticeable now than at 15 weeks. 3. Breast transformation. Again, just when you got used to the size increase, your breasts change again. Veins may become more visible. Your areolas darken further. Some women leak colostrum, a golden early milk filled with antibodies. It's all part of your body preparing to feed your baby. 4. Varicose veins or visible veins. You may notice purplish veins on your legs or even around your vulva. Why? Increased blood flow plus hormone-induced vein dilation. Compression socks and leg elevation can help. 5. Constipation and gas, still hanging around. Progesterone slows down digestion to allow better nutrient absorption for your baby. Unfortunately, that means bloating, gas, and constipation may still be persistent. Increase fiber, hydrate more, and consider natural stool softeners with your provider's advice. 6. Pregnancy brain. Yes, it's real. You put your keys in the fridge again, forgot your password, or missed a call you scheduled. Blame the pregnancy brain. A mix of hormonal changes, poor sleep, and mental preoccupation causes forgetfulness. It's temporary, and totally okay. 7. Emotional grounding begins. By 16 weeks, many women feel emotionally more stable than the turbulent first trimester. You might find yourself daydreaming about baby names, envisioning your nursery, or just talking to your bump. That's the power of connection. Let's talk about what to expect at your week 16 prenatal appointment. If you haven't had it yet, your 16-week prenatal visit might be one of the most emotionally rewarding yet. Here's what may happen. Most providers will use a Doppler to let you hear your baby's heartbeat, a moment many moms describe as unforgettable. Maternal blood screening. This is the week some doctors offer the quad screen, a blood test that screens for chromosomal conditions like Down syndrome or neural tube defects. Weight, blood pressure, urine tests, routine but vital. Urine checks screen for protein and sugar, potential signs of preeclampsia or gestational diabetes. Questions and concerns. Write yours down beforehand. No question is too small when growing a human. Tip: bring your partner or a loved one. Hearing the baby's heartbeat together can create a beautiful bonding experience. Let's discuss nutrition and lifestyle, what to eat and what to avoid. By week 16, your baby is growing fast, and they need fuel. The right nutrition now lays the foundation for your baby's bones, muscles, brain, and immune system. Key nutrients this week to consider this week. Iron. Prevents anemia and supports baby's blood development. Eat lean meats, spinach, and fortified cereals. Calcium. Essential for bone development. Try dairy, broccoli, and fortified plant milks. Omega-3, DHA, supports brain and eye development. Think salmon, walnuts, or prenatal supplements. Vitamin D, helps calcium absorption. Step outside or take your prescribed dose. Avoid raw fish or unpasteurized dairy. Too much caffeine, stick to under 200 milligrams per day. Alcohol and smoking, including secondhand smoke, emotional wellness and bonding with your baby. Now that your baby can hear, it's a beautiful time to start speaking, singing, and reading aloud. Your voice will become a source of comfort, even before birth. You can leverage on these ideas for bonding. Play soft music, classical or calming lullabies, start a baby journal, record how you feel each day. Meditate with your hands on your belly. Take slow nature walks and talk to your baby. Week 16 do's and don'ts recap. Do. Keep up prenatal appointments and screenings. Sleep on your side, preferably left. Stay active, even 30 minutes of walking helps. Hydrate more than you think. Celebrate milestones, you're growing a life. Don't overexert yourself physically. Compare your bump or weight gain to others. Ignore persistent pain, bleeding, or dizziness. Neglect your mental health. Week 16 isn't just a number, it's the gentle start of a deeper connection. You're not just growing a baby, you're growing into a mother. With every heartbeat you hear, with every stretch and flutter you feel, you're writing the first pages of a love story that lasts forever. Thank you for walking this journey with me. If this video touched your heart or taught you something new, give it a like, share it with another mama-to-be, and subscribe for next week's update, 17 weeks of magic, milestones, and motherhood.